Tubectomy. So once you have got your tubectomy done, means your tubes have been ligated. Whether it was ligated, maybe the first marriage was there, your family was complete, that time you decided to get it ligated, and by some reason you have got married again and now you want to have a child, or the child expired due to some reason, or any unforeseen circumstances in your life, because life is a roller coaster ride, anytime anything can happen, and now you want to have a child. So what to do? So there are two options. One, we go for IVF directly, and second, we try to open those tubes. So that is a reversal of your fallopian tube, the surgery that has been done, reversal of that. So it is possible laparoscopically, if the tubes are not that crushed, it has not been burnt. And most thing that is important is, many times the patients come to me, they say that they have already undergone this surgery but they are not able to conceive. So first and foremost, before these kind of surgeries are being undertaken, we need to rule out other factors also, that you are not having any ovulation problems, any other uterine problems, any male factor, and the cilia of the tube has to be okay. So what happens, many times the tube is open but it is not functional because the cilia have been permanently crushed. You just imagine that it is sort of a pipe. So the pipe has been like, it has become bad, it has become mutilated, and now you are cutting that portion of the pipe and then you are trying to again establish the function of the pipe. So many times it is possible, the function can be established if the pipe is not damaged, but if it is damaged, you have to change that pipe. So like that, what we call transplantation. But there is no fallopian tube transplantation that has come. So in that case, the patient is left with no other option than getting the IVF done. So you can definitely try a laparoscopically reversal of the procedure if you want, but you have to keep that in mind. The success rate is very less of these kind of procedures, only 5 to 10%, because many times when the ligation is done, it is done so that you don't have failure of the ligation process, because if the failure of the ligation process happens, then you will have a child, you don't want that child. So obviously in that case, the tube has been properly tied, it has been properly mutilated, so that that doesn't get reversed automatically and you are not able to conceive. So in that case, when it has been properly mutilated, burned, in that case the reversal surgery is usually a failure, and the patient has to undergo IVF procedure after the reversal surgery also. So keeping this in mind, if still you want to go for the surgery, that is totally your call, because, and with that you have to discuss with the doctor's team, because as you know, it does get reversed in 5 to 10% of cases, and so in that cases we cannot say that okay, this is not possible totally, but obviously the chances are less that it will be reversed, and maybe after the surgery also you have to go for the IVF treatment. But keep trying, you don't know when you will be pregnant, when the stock is going to visit you.